The fluorescent lights hummed their endless song overhead as Elena Martinez pulled on fresh scrubs, the fabric still damp from the industrial washer. 3 years she'd been coming through these back corridors at Oak Creek Memorial, 3 years of 6 a.m. arrivals and staying past her shift to finish charting, and the fluorescent hum never changed. Neither did the antiseptic smell, sharp, almost metallic, like something was burning just beneath the surface. She threaded her badge through the clip, the plastic cool against her fingers, then pulled the neckline of her scrubs down just enough to slip the chain over her head. The dog tag settled against her sternum, cold against her skin. She straightened her shirt. The tag was invisible now, buried beneath cotton and professionalism, just the way it needed to be. The way it had been since Kandahar. Elena moved through the pediatric ICU hallway like water finding its course, no wasted motion, no sudden turns. Her shoes made no sound on the linoleum, a rhythm she perfected years before any of this, when quiet meant survival. The morning shift was already cycling through, nurses clustered at the station reviewing overnight notes, the kind of casual conversation that stopped when she approached. She was polite. They were professional. Nobody asked her to lunch. Nobody asked her anything. It was safer that way. She grabbed the patient roster and scanned the overnight admits while the coffee in her hand went cold. Pediatric ICU at Oak Creek usually ran at 60% capacity, routine cases, stable kids, manageable nights. This morning was different. One new admission. 7 years old. Male. Reason for admission, acute mutism following trauma. Non-responsive. Psychiatric referral pending. The room was at the end of the East Corridor, the kind of space they saved for families who needed privacy or kids who needed to be isolated. Elena could see Colonel Brennan through the small window in the door before she even knocked, dress uniform despite the hour, sharp creases like he'd spent the morning getting himself ready for battle instead of waiting with his son. The boy sat in the hospital bed small as a sparrow, dark eyes too wide, one hand gripping the blanket like it might try to escape. The other hand was tucked against his chest, trembling. Elena took a breath, the kind of breath she'd learned to take 17 years ago in a field hospital with incoming mortars walking closer, and knocked. "Morning," she said. "I'm Elena. I'll be monitoring him this shift." Colonel Brennan stood. He was tall, the kind of tall that made doorways seem smaller, with the posture of someone who'd spent 2 decades being told to stand straighter. His eyes were red-rimmed and hollow, the expression of a father who'd tried everything and found nothing. "His name is Tommy," he said, and his voice came out careful, as if speaking might shatter something. "He was in a car accident 2 weeks ago. He was conscious, responsive, no significant injuries beyond the concussion, but he hasn't spoken since. Not one word." Elena approached the bed slowly, her movements deliberate. Children were like animals sometimes, they read intention in the way you moved, the speed of your approach, the rhythm of your breathing. She let Tommy adjust to her presence before she did anything else, a learned patience from standing in triage with dozens of screaming kids, learning which ones needed emergency treatment and which ones needed someone to just sit with them for a minute. "Hi, Tommy," she said quietly. "I'm going to check a few things. That okay?" She kept her voice at the level of someone speaking to someone who understood everything, because trauma made some kids selective about what they heard, and this kid's brain had decided words were dangerous. His eyes tracked her movements as she reached for the blood pressure cuff, the gentle latex sound as she pulled it from the wall unit. His left pupil dilated slightly as she leaned closer, just a hair's difference from the right. Elena kept her expression neutral, kept moving through the vitals with the same calm efficiency she'd carried through 3 tours in Kandahar, where noticing small things meant people survived and missing them meant writing letters to parents back in the States. Blood pressure 112/71, normal for a 7-year-old. Heart rate 94. Temperature 37.2. O2 sat 98% on room air. Everything a pediatric neurologist should check, everything that added up to a story the discharge summary hadn't told. She documented everything in the chart, not just the numbers, but the observation. Slightly asymmetrical pupils, left greater than right, possibly reactive but worth monitoring. Trauma-caused pupil changes. Concussions caused pupil changes. But so did other things. Things that required more than a psychiatric consultation. Dr. Ashford arrived for morning rounds at 7:16 a.m., 5 minutes before he was technically supposed to be there, which meant he was exactly on time in his own mind. He moved through the corridors the way men in expensive watches move, with the confidence of someone who'd never had to rush. His silk tie was probably worth more than Elena's monthly car payment. He glanced at her as she stood by the nursing station, the kind of glance that registered her presence the way you register background music, and then he was turning toward Tommy's room, pen clicking between his fingers like a habit. Elena followed at a distance appropriate for a nurse, close enough to assist, far enough to be invisible. "Good morning, Tommy," Dr. Ashford said, his voice shifting into the specifically modulated tone he used for families, warm but authoritative, the voice of someone accustomed to being believed. "I'm Dr. Ashford. Your father tells me you've been through something difficult, but you're going to be fine." He performed an examination that was competent and complete and entirely missed the point. Pupils checked with a penlight, cranial nerves tested, motor response normal. Everything the standard pediatric protocol demanded. He didn't ask about the subtle asymmetry. He didn't order anything beyond what was already ordered. When he stepped back into the hallway, Elena was there with the chart. "His neurological signs suggest possible intracranial involvement," she said quietly, keeping her voice level, keeping her words precise. "The pupil asymmetry, the selective mutism. I'd recommend we get neuroimaging, possibly an MRI." Dr. Ashford's jaw tightened almost imperceptibly. The boy experienced a traumatic incident. "His mutism is psychosomatic. Conversion disorder." He said it the way a closing argument was made, final and definitive. Further imaging would be unnecessary, expensive, and potentially harmful to his psychological state. The child needs psychiatric evaluation, not more procedures. "I'll be ordering a psych consult this morning." He turned away, the kind of turn that was supposed to end conversations, and Elena stood with the chart still in her hands, the weight of certainty pulling downward like gravity. She knew better than to push. The hierarchy of hospitals was simpler than military command structure and infinitely more rigid. Doctors ordered, nurses documented. Doctors diagnosed, nurses carried out the diagnosis. A nurse who questioned a doctor's assessment with only observations and concern was a nurse who created friction, and friction created problems. Elena had spent 3 years creating 0 problems. She went back to Tommy's room and charted her assessment in the most careful language possible. Nurse notes suggest consideration of further neurological investigation pending physician evaluation, the kind of language that covered the medical legal requirement to document without creating the appearance of challenge. The rest of the shift unfolded in the established rhythm of the pediatric ICU. Elena monitored Tommy's vitals every hour, noting the asymmetry of his pupils, the way his tremors intensified when his father wasn't in the room, the specific pattern of his breathing that suggested autonomic distress. She was thorough and quiet and entirely unremarkable. Her co-workers moved around her with the practiced indifference of people maintaining appropriate professional distance. Brianna from the overnight shift gave her a quick nod, not cold, just careful. Marcus from respiratory therapy asked if she needed help repositioning any patients, accepted her answer that she didn't, and moved on. Nobody asked her opinion about Tommy's case. Nobody asked her anything at all. The dog tag felt heavier as the shift progressed. Elena touched it once when she was alone at the station, a habit so ingrained it happened without thought, her fingers pressing against the chain through her scrubs. The name on the metal wasn't hers. It belonged to someone who'd made a choice she couldn't undo, someone she'd held while his blood turned the sand dark, someone whose mother she'd never had to tell was gone because that letter came from official channels while Elena was already running toward the next injury, the next crisis. She'd earned the right to be invisible years ago. Being invisible was the only way to survive having secrets this large. By the time her shift ended at 2 p.m., Tommy Brennan was scheduled for psychiatric evaluation the following morning and no further imaging had been ordered. Colonel Brennan sat beside his son's bed looking like a man who'd lost every argument that mattered. Elena handed off her notes to the day shift nurse, Jessica, capable and kind and entirely unlikely to notice what Elena had noticed. The drive home always took the same route, past the same convenience store and the same billboard for a cancer clinic. The evening would be quiet. The evening was always quiet. But that wasn't the worst part. The hallway stretched quiet at 6:53 a.m., before the machines woke up, before the day shift flooded in with their coffee and their schedules and their certainties. Elena moved through it like she'd moved through the corridors of a forward operating base, purposeful, invisible, present only when necessary. Her scrubs were navy blue. Her badge hung at her hip. Beneath the collar of her shirt, the dog tag rested cold against her sternum, a weight she'd learned to carry without flinching. Dr. Ashford was reviewing charts at the nurse's station, pen moving with the kind of mechanical precision that came from 30 years of never being wrong. Never admitting it, anyway. Elena had watched him for 3 months now, long enough to understand the pattern. He moved through Oak Creek Memorial like a man who'd never questioned a decision in his life, who wore certainty the way other men wore watches. She approached with her tablet, voice steady and low. "Dr. Ashford, I need a moment about Tommy Brennan." He didn't look up. The pen kept moving. "The mute boy. Psychogenic mutism. The case is clear. His pupils are slightly unequal." Elena kept her voice level, clinical, deferential. The old voice. The nurse voice. "I've noted the asymmetry in his last 4 vital checks. Left pupil dilating. Combined with the post-traumatic presentation, I think we should run a CT to rule out intracranial." Nurse Martinez. He set the pen down. Set it down deliberately, like the gesture itself carried weight. He finally looked at her, and his smile arrived before his words did, the kind of smile that came from knowing something you didn't. "Stick to taking temperatures. The boy's condition is psychogenic. I've seen dozens of cases. Conversion disorder is exactly what this presents as." She didn't retreat. Didn't nod obediently. Just stood there, tablet in her hands, and said, "The pupillary response doesn't match. It matches trauma. It matches a child in shock." His voice dropped, became something colder. "It doesn't match your assessment, which is all that matters here." She turned and walked away before he could dismiss her again. But the weight of the dog tag seemed heavier beneath her shirt. During afternoon rounds, she tried once more, standing beside Colonel Brennan as Dr. Ashford made his way through the pediatric ICU, residents trailing behind him like remoras. Tommy lay in the bed between them, small and silent, his eyes tracking nothing, registering nothing. The colonel's uniform made the casual clothes of the hospital staff look like pajamas. A man accustomed to being obeyed stood next to a boy who couldn't speak. Elena made eye contact with Brennan. "Colonel, with your permission, I'd like to suggest that neurological imaging might provide additional diagnostic information, given the trauma history." "Nurse," Ashford said. His voice carried across the room like a radio transmission cutting through static. "A word." He took her into the hallway, and his voice became a razor blade wrapped in silk. "You just questioned my diagnosis in front of a patient's family. You understand chain of command, or did that not make it into your nursing curriculum?" She met his eyes. "I'm concerned about the patient." "Your concern is noted. Your suggestions are not welcome." He leaned closer, and she could smell the coffee on his breath, the clinical soap that never quite washed away. "Stop now, or I will document it. Do you understand me?" She did. She understood perfectly. The next morning brought rounds with the full team assembled, Dr. Ashford at the center of the storm, residents and nurses arranged like planets around a sun that had begun to collapse into itself. Colonel Brennan stood at the foot of Tommy's bed, his hand resting on the metal rail. The boy's breathing was shallow and even. Unconscious, or nearly so. The machines beeped their mechanical lullaby. "Nurse Martinez," Ashford announced, his voice pitched to carry, to perform, "has some concerns about my diagnosis. Perhaps with her." He paused. Smiled. "Limited education, she's unfamiliar with conversion disorder. Tell me, did they cover psychiatric conditions in your associate's program, or were you too busy with bedpan rotation?" One of the residents smirked. The charge nurse looked at her shoes. Colonel Brennan's jaw tightened, but he said nothing. Elena stood there, and inside her chest something went very still. Not trembling. Not burning. Still. The kind of stillness that comes after you've already survived the worst. Her hand brushed the dog tag beneath her scrubs, just for a moment, just enough to anchor herself to something real. To remember who she actually was. A single tear escaped her left eye. Just one. Not from sadness or fear or wounded pride, but from the precise, controlled release of pressure that builds when you're holding something down so hard it starts to hurt. She wiped it away without breaking eye contact with Ashford. When she spoke, her voice was quiet and level, each word distinct and separate. Respectfully, Doctor, that boy's symptoms don't match the pattern. Respectfully. He laughed. The laugh was cruel in the way that only the certain could laugh. You don't get to have medical opinions, Nurse Nightingale. The room went quiet. Even the machines seemed to pause, as if they sensed the line being crossed. Colonel Brennan's hand gripped the bed rail hard enough that his knuckles went white, but he still didn't speak. What would he say? He was standing in a hospital. He was standing in a system. He was standing in a place where his rank meant nothing and a physician's certainty meant everything. By noon, a printed notice appeared on the unit board. Elena saw it when she returned from break, a formal write-up, her name at the top, the accusation typed in clinical language, overstepping scope of practice. Undermining physician authority. Inappropriate challenge to diagnostic assessment during patient rounds. Creating doubt in the presence of family. Documented insubordination. Ashford had dated it 7:22 a.m. He'd typed it up this morning, maybe while she was in Tommy's room checking his vitals. He'd been planning it before she even approached him in the hallway. The paper trail was everything in a hospital. The paper trail protected physicians. The paper trail buried nurses. She took the notice down and read it twice, committing every word to memory. Then she posted it back on the board. Let everyone see what happened when you said something that threatened a man's certainty. When Elena entered the break room at 1:15 p.m., 4 nurses were gathered around the small table, eating lunch from Tupperware containers. They looked up as she came through the door. Made eye contact for exactly 2 seconds. Then, without a word, not a single word, they gathered their lunches and filed out. Davis and Cho and Rodriguez and someone whose name Elena had learned but would never hear spoken again in this place. The break room door swung shut. Elena sat at the empty table. The fluorescent light above her hummed its electrical prayer. She could hear the ICU through the wall, the distant beeping of monitors, the creak of stretcher wheels, the low voice of someone paging a specialist. The hospital was still running. The hospital would always keep running. It didn't matter if she was here or gone. It didn't matter if a single nurse noticed something everyone else missed. She took one measured breath. The kind she'd learned in Kandahar, when the trauma bay was full and there was blood on her hands and someone's life depended on her thinking clearly instead of feeling. In and hold and out. Control the breath, control everything. A tear escaped her left eye. Just one. She wiped it away. Dr. Ashford passed by the break room window, coffee cup in hand, and paused. He saw her sitting alone at the empty table. He smiled. The smile was the smile of a man who'd just won something. The smile was the smile of a predator who'd convinced his prey that resistance was pointless. Elena looked up and met his eyes. Her voice when she spoke was quiet enough that he had to pause to hear it. That boy is dying, and you know it. He laughed and kept walking. But that wasn't the worst part. The worst part came later that evening, when Elena sat in her apartment reviewing Tommy's chart on her personal laptop, her own blood pressure rising with each entry she read. The pupil change was getting worse. The subtle shift in his responses, slower, more sluggish, like something was pressing down on his brain from the inside. The vital signs were telling a story that nobody in authority was listening to. A story that only she could read because she'd spent 12 years reading similar stories in tense and hums and forward positions where there was no hospital, no hierarchy, no authority except the raw biology of human suffering. She had to make a choice. Go through channels and watch a child die while she waited for permission. Or act. She thought of the colonel's face during rounds. She thought of Tommy's blank stare. She thought of a young medic in Kandahar who'd asked her what to do, and she'd told him to wait for the surgeon, and the surgeon had arrived 8 minutes too late. By midnight, Elena had made her decision. Tomorrow morning, she would go directly to Colonel Brennan with everything she had. She would bypass Dr. Ashford entirely. She would violate the chain of command because the chain of command had failed, and she'd learned a long time ago that sometimes you have to break protocol to save a life. She'd learned it in a field hospital. She was about to learn it all over again in Houston, Texas. She had no idea what was about to unfold. No idea that going around Ashford would accelerate his descent into something far more dangerous than condescension. No idea that a physician's fragile certainty, when threatened, could manifest in ways that reached far beyond the unit board. All she knew was that somewhere in the ICU, a 7-year-old boy was running out of time, and his father had a uniform that meant something. It might be enough. It would have to be enough. The 6:11 a.m. vital signs check started like every other morning. Elena moved down the row of beds with her tablet, reading numbers, making notes, existing in the way that made her invisible, efficient but unremarkable, one more nurse in a unit of dozens. Then she reached Tommy Brennan's bedside. The boy lay still, his small chest rising and falling with the measured rhythm of someone sleeping. Elena's eyes moved through the standard assessment: oxygen saturation 94%, heart rate 88, blood pressure stable. Everything textbook. Everything normal. Then she looked at his face and her hands stopped moving. His left pupil was dilated. Noticeably. The right one was responsive, normal, but the left had opened like a door to something darker. Elena's breath didn't change. Her pulse didn't quicken. The medical term arrived in her mind the way information had always arrived in forward operating bases: clean, factual, impossible to ignore, anisocoria. Unequal pupils. Classic sign of increased intracranial pressure. Brain bleed. Herniation coming. She reached for her phone. Paged Dr. Ashford at 6:51 a.m. Waited. No response. Paged again at 6:54. Nothing. She pulled up the hospital system and checked his calendar. Board meeting. 7:13 a.m. through 10:53 a.m. Conference room C, building 3. He'd blocked his schedule deliberately. Unreachable by design. Elena stood very still beside Tommy's bed. She could feel the seconds ticking like a countdown to something she couldn't stop. The on-call neurosurgeon, Dr. Chen, competent, available, who would have ordered imaging and probably intubation, was no longer available either. She'd pulled his chart an hour ago out of habit. Reassigned to Mercy General across town for the morning shift. A decision made by hospital administration yesterday, routed through Dr. Ashford's office. No coincidence. A strategic move. Preemptive sabotage. Remove the one person who might contradict him, lock the chain of command, and leave Elena alone with a child whose brain was bleeding and no path to intervention that didn't require her to be invisible. Tommy's heart rate climbed to 92. 95. The respiratory rate shifted, faster, shallower. His right hand twitched. Small tremor. Seizure activity or deteriorating neural function, Elena couldn't tell yet, but the trajectory was clear. In the Sanjin Valley in Helmand Province, she'd seen this progression twice. Both times, the soldiers had been unconscious within minutes. Herniation followed. Both times, she'd worked without authorization, without equipment, with nothing but field dressings and a combat knife she'd used to make an emergency decompression opening through the anterior fontanelle of a 14-year-old Afghan boy with a shrapnel wound who'd shown the exact same signs. That boy had survived. Elena had carried his face in her memory for 7 years. She moved to the supply room without rushing, without appearing urgent, because speed in a hospital looks like panic and panic looks like someone who doesn't know what they're doing. She pulled the emergency procedure kit from the cabinet, sterile field pack, hand crank burr drill, 4.0 sterile gloves, betadine, gauze, suction bulb. Everything she needed. Everything she couldn't possibly be allowed to use. She returned to Tommy's room and set the kit on the bedside table, laying it out the way she'd laid out instruments in a field hospital 7 years before anyone knew her name. At 7:16 a.m., Tommy's oxygen saturation dropped to 89. His left eye was barely responsive now. The right-hand tremor had spread to both arms. Elena pressed the call button and Mariah arrived, the one tech from the floor who'd been kind enough to bring her coffee last Tuesday, before the public humiliation, before the written warning, when kindness was still a reflex instead of a liability. "Get me the charge nurse," Elena said. "Tell her I'm ordering an emergency neurological procedure under Dr. Ashford's standing protocol for acute intracranial decompression. I need her to document my order immediately." "And Mariah," Elena made eye contact. "Don't argue about this. It's happening. Either you help or you leave the room. There is no middle ground." Mariah's face went white. She left. She returned 70 seconds later with charge nurse Patricia, who walked in looking irritated and left looking like someone who'd just watched the world reshape itself. Elena was already gloved, already moving, the kit open before her like a map she'd memorized in a war zone. Tommy lay sedated now. Elena had pushed 2 milligrams midazolam 4, which wasn't protocol either, wasn't even her legal right, but his seizure threshold was dropping and sedation would make the procedure possible. His left pupil dilated, Elena said to Patricia, not asking, informing. Unequal response indicating epidural or subdural bleed with mounting pressure. Dr. Chen's gone across town. Dr. Ashford's unreachable. This child goes into herniation in maybe 8 minutes if we wait for anyone else to make this decision. Patricia didn't speak. She just nodded and positioned herself at Tommy's head, her hand steady, her face composed in the way of someone who'd just understood that the nurse pushing medication and preparing a burr drill was either a criminal or a hero, and that both of those things might be simultaneously true. Elena marked the burr site. 2 centimeters anterior to the coronal suture, 3 centimeters lateral to the midline, the classic location for an epidural access point, even on a child, maybe especially on a child where any error cascades faster, where the margin for mistakes compresses in 2 millimeters. She cleaned the site with betadine in concentric circles. The smell of iodine rose sharp and clinical. Her hands were steady. Her breathing was steady. The trembling that lived in her chest and had lived there since Kandahar stayed behind her ribs where it belonged. Colonel Brennan appeared in the doorway. His face was a military face, composed, but Elena could read the small movement at the corner of his jaw that meant he was watching his son and seeing something he didn't understand and was choosing not to look away. "I'm creating a burr hole," Elena said to him, her voice carrying the tone of someone explaining a decision already made. "Emergency decompression. Your son has a bleed putting pressure on his brain. Without this, he stops breathing in maybe 5 minutes. With this, he lives. You can have that or you can have protocol. You can't have both." The colonel didn't speak. He stepped into the room and moved to the opposite side of Tommy's bed from Patricia, and his presence became a kind of permission, the only kind Elena could get. She positioned the hand drill. The device was mechanical, pre-sterilized, designed for exactly this purpose, though nobody was supposed to use it without a neurosurgeon and an operating room and full monitoring. Elena had used field equipment under worse conditions with less certainty. She began to turn the crank. Steady rotations. Pressure, not force. The bone resisted, then yielded. The resistance changed as the drill bit pushed through the outer table of the skull, through the diploic space, through the inner table. She felt the moment of breakthrough the way she'd felt it 1,000 times in memory, the subtle shift as the resistance vanished and the bit entered the epidural space. Blood appeared. Dark, venous blood, which meant the bleed was exactly where she'd predicted. Exactly where the dilated pupil had been screaming its location. Elena released the crank and let gravity and pressure do the work. The blood dripped into the waiting gauze. Tommy's color began to change. His breathing deepened. The seizure activity in his arms stopped. She looked at the monitor. Heart rate coming down from 98 to 84. Oxygen saturation rising from 88 to 91 to 94. His right pupil response, she leaned closer, watching the light reflex, was beginning to improve. The asymmetry was still visible, but the left pupil was reactive again, constricting slightly as she held the penlight before it. The pressure's equalizing, Elena said to Patricia. He's stabilizing. Patricia's hands were shaking now, but her voice was steady. You saved his life. The words hung in the room like a trigger. Elena's hands were already moving, already cleaning the site, already bandaging the burr hole with sterile for gauze and securing it with surgical tape. She had maybe 90 seconds before someone called it in. Maybe 2 minutes before someone with authority arrived to assess what had happened here. She'd committed the one unforgivable act in modern medicine. She'd operated without a license, without authorization, without the permission of the person whose name appeared at the top of every legal document in this hospital. The door opened at 7:23 a.m. Dr. Ashford stood in the doorway. His eyes moved from Elena's gloved hands to the open procedure kit to Tommy's stabilizing vitals to the bandaged burr hole on the child's skull. His jaw went tight. Not the tight of surprise. The tight of a man whose calculation had just inverted. He'd built a wall of rules and hierarchy and removed every ally and closed every channel of help specifically so that Elena would be forced to choose between protocol and the child. He hadn't accounted for her choosing the child. Security. Building 3, ICU, immediately. His voice was flat. Not angry. Calculated. This nurse is to be escorted off the floor. She has violated every standard of care and endangered a minor through an authorized medical practice. Notify risk management. Notify the state nursing board. Now. Elena pulled off her gloves and dropped them in the biohazard waste. She turned to face him. Her eyes were clear. Not ashamed. Not apologetic. Not begging for understanding. Just clear, the way eyes look when they've already paid every price they're ever going to pay and found it reasonable. He was dying, she said. You knew it. You made sure no one else could help him. So I did. Dr. Ashford's face didn't change. He'd already turned away, already walking, already on his phone with the 3 board members who owed him favors, already beginning the phone calls that would ensure no hospital in Houston would touch her again, already erasing her from the system the way the Pentagon had erased her once before. Security arrived at 7:27 a.m. 2 guards, professional, trained in hospital de-escalation. Elena didn't resist. She simply stood and walked with them toward the door. Colonel Brennan was still there, still present, still watching. As she passed Tommy's room, the boy's eyes opened. Barely focused yet, but open. Responsive. Alive. The colonel caught her eye. Elena nodded once. Then she was walking. The ICU doors opening. The hallway stretching. The world she'd hidden in for 3 years peeling away like old paint. The charge nurse's voice came through the intercom before Elena could move. Code Blue, Trauma Bay 3. The ICU shifted, machines beeping their familiar songs, but Elena was already moving in the opposite direction. Tommy's room. His pupils had changed in the last 4 minutes. One larger than the other. Blown pupil. The kind that meant time had stopped measuring itself in hours and started measuring itself in minutes. She grabbed the emergency procedure kit from the crash cart without asking permission, muscle memory taking over. Her hands didn't shake. They never had. The trembling wasn't fear. It was restraint. All the years of hiding, all the careful deference, all the yes, doctor and the lowered eyes, it was burning away now like old paint in a blowtorch, revealing what was underneath. Steel. I need you to call Dr. Ashford, Elena said to the charge nurse, her voice dropping half an octave, the voice of someone used to giving orders that kept people alive. Tell him I'm performing an emergency neurological assessment under implied physician oversight. And I need this room sealed. Nobody in or out. The charge nurse hesitated for exactly 1 second. That was all Elena needed. The authority in her movements, the precise way her hands moved across Tommy's chart, the flat competence in her eyes, it was a language only medical people understood, and it overrode every question about scope of practice. Clear the room, Elena added. Not a request. A command. She didn't watch them leave. She was already opening the procedure kit, her fingers moving through the familiar landscape of surgical steel and sterile fields like a blind woman reading Braille. Scalpel. Gauze. Sterile drapes. The smell of antiseptic rose up like memory, not hospital antiseptic, but the sharper bite of field-grade surgical soap in a shipping container outside Kandahar, the kind that burned your nose and never quite washed off your hands. Tommy's eyes fixed on her. Scared. Trusting. The way her soldiers had looked at her when the mortars started falling. Stay with me, buddy, Elena whispered, and she meant it in a way that transcended the 8-year-old boy on the stretcher. Stay with me. Stay alive. Stay in the world that's waiting for you. She prepped his scalp with methodical precision, marking the burr hole site, the temporal area, above the zygomatic arch, the exact location where trapped blood puts pressure on the brain like a fist tightening around something fragile. Her hands had done this before. Not in a sterile ICU. In the back of a Humvee that was taking fire. In a forward operating base made of sandbags and prayers. In a convoy that shouldn't have existed, on a mission that was never supposed to happen, with soldiers whose names she carried on a broken chain beneath her scrubs. The drill bit spun. A sound like whispered rage. Like the past refusing to stay buried. The moment the needle decompression released the intracranial pressure, Tommy's breathing changed. Easier. Deeper. His oxygen saturation ticked up on the monitor, from 84 to 87 to 91. The hiss of air escaping, the sound of pressure releasing, the physical proof that she'd been right all along. The door opened. Colonel Brennan stood in the threshold, still in his flight suit, and Elena heard his breath catch. He was watching his son's neurological signs transform in real time, watching the boy's color shift from gray to pink, watching a woman with a drill and steady hands pull his child back from whatever edge he'd been sliding toward. Keep pressure on the site, Elena said, not looking up, still working. Still commanding. His ICP's dropping. We're going to need imaging to confirm the hematoma's size, but the pressure relief bought us time. Maybe saved his life. Colonel Brennan didn't move. Just watched. His jaw was tight, his eyes tracking every movement of her hands. Recognition dawned across his face, not of her identity yet, but of something deeper. He was watching someone who had done this before. Someone who knew exactly what they were doing. It took 43 minutes to finish the procedure. To dress the burr hole site. To get Tommy stabilized. To lower his head slightly and secure his neck. Dr. Ashford arrived at minute 44, his face flushed, his voice already sharp with authority. What is the meaning of this? Who ordered an emergency procedure in my ICU without physician supervision? Elena straightened. She turned to face him. And in that moment, standing over a child she'd just saved, wearing scrubs that suddenly felt like a uniform, she allowed her shoulders to roll back slightly. The posture changed everything. The angle of her jaw. The flatness of her eyes. The child presented with acute neurological deterioration consistent with epidural hematoma, Elena said, her voice carrying the weight of someone who had testified before military tribunals, who had briefed officers, who understood the architecture of authority and had built herself inside it once before. Bilateral pupil dilation. Decreasing mental status. You were unreachable. The procedure was necessary. Dr. Ashford's face went white, then red, then the specific shade of purple that came when a man realized his carefully constructed power was paper. He looked at Colonel Brennan. He looked at Tommy. He looked at Elena's hands, still gloved, still steady, still carrying the muscle memory of 1,000 decisions made under fire. You performed surgery without a license, Dr. Ashford said, and his voice was shaking now. Shaking with something that looked like fear. You violated every protocol in this hospital. Security. I want security in here immediately. He turned and walked out. His phone was already in his hand. Elena helped the charge nurse finish securing Tommy's monitors. She documented the procedure with clinical precision, every drug, every measurement, every moment. She knew what was coming. She'd seen men like Ashford make phone calls before. They had friends. Allies. People who owed them favors. People in positions that could erase you. Colonel Brennan was still watching her. He hadn't left the room. His presence was a weight, an anchor, something real in a room that was about to become very unreal. "Thank you," he said quietly. Only 2 words. But they carried the weight of 17 people, of classified operations, of a son who would have died in his sleep without someone willing to risk everything. Elena nodded once. She finished removing her gloves. One more item to add to the list of things she'd lost today. Security arrived at 4:56 p.m. 2 officers she recognized from the morning shift, looking uncomfortable and confused. They held the escort position loosely, as if they didn't quite want to be there. "Ms. Martinez, you're going to need to come with us," one of them said, and she heard the apology in his voice. "Dr. Ashford has filed a formal complaint with hospital administration. He's saying you performed a surgical procedure without licensure." Elena nodded. She'd already anticipated this. She'd spent 3 years anticipating things. It was the one skill she'd never lost. "May I collect my personal items?" she asked. Of course. The locker room smelled like coffee and industrial cleaner. She pulled down the cardboard box she kept on the shelf, the one she'd learned to keep packed, just in case. The cracked mug that said "World's Okayest Nurse," picked up at a gift shop in Austin 3 years ago. The succulent she'd never remembered to water, slowly dying in its ceramic pot. And the photo. The one she pulled out once a month and never showed anyone. A young man in desert fatigues, grinning at the camera, holding a rifle that had jammed in the middle of an ambush. Specialist Marcus Webb. The medic who'd tried to reach her after the IED went off. The one she couldn't reach back. The dog tag around her neck suddenly weighed 1,000 pounds. The rain started just as she reached the bus stop. October rain in Houston, warm and thick, the kind that made the asphalt steam. Elena sat on the bench beneath the shelter and held the box on her lap, watching the rain fall in sheets that obscured everything beyond 20 feet. For months ago, she'd thought disappearing was behind her. She'd thought the erasure was done. They'd taken her records, buried the operation, officially told the world she didn't exist. She'd accepted that. Made peace with it. Built a life inside the shadow where they'd told her to hide. But this was different. This wasn't institutional erasure. This was personal. This was a man protecting his ego by destroying her career. This was the second time in 14 years she'd been erased, and the second time she'd done it by saving lives. She pulled the dog tag out from beneath her scrubs. It caught the streetlight, gold and dented, the name worn smooth by 14 years of being carried against skin. Major Elena Martinez. Not anymore. There was no Major. There was no Elena. There was no one at all. The bus pulled up. She didn't get on. Just sat there, the box heavy on her lap, the photo of Marcus Webb staring up at her with that grin, that absolute certainty that someone had his back. That someone would reach him. That someone would find him in the chaos and pull him back. She'd failed once. She'd managed to save 17 others. She'd managed to save Tommy Brennan. And now she was disposable again. The rain fell harder. It mixed with something on her face that might have been tears, but Elena didn't bother to distinguish anymore. She'd learned to hide tears inside rain years ago. At Oak Creek Memorial, Dr. Ashford completed his evening rounds, and for the first time in 23 years, he didn't feel invincible. He'd made the calls. 3 board members who owed him favors. By morning, Elena Martinez would be flagged in every hospital system in Houston. By end of business, her nursing license would be under formal review. Within a week, she would be unemployable. He'd won. He'd always won. That was how men like him survived. But in Tommy Brennan's room, the colonel sat beside his son's bed and stared at a child whose pupils were equal, whose breathing was steady, whose brain was finally getting the oxygen it needed. And he thought about the woman who'd done that. The woman with hands that moved like muscle memory itself. The woman whose eyes had changed completely the moment she decided to save his son instead of following protocol. He'd heard rumors about medical personnel in Kandahar. Stories that got passed around in officers' clubs. Classified medics who could do things that weren't supposed to be possible. Who could make life decisions in rooms where there were no options left. Colonel Brennan pulled out his phone. Made a call he'd thought he'd never make. Started asking questions about an operation that was officially buried so deep it would take someone with his clearance to reach it. By the time Elena sat at that rain-soaked bus stop, Marcus Chen, IT specialist, former Marine, third-floor office near the network hub, was already pulling security footage from his archived drives. He'd served in Fallujah. He knew combat medicine when he saw it. He knew what desperation looked like when it had hands and skill and was willing to risk everything. And he knew something else, he knew cowardice. He'd seen it in insurgent fighters who ran. He'd seen it in officers who made decisions with clean hands. He'd seen it in Dr. Ashford walking out of that ICU with his phone already dialing. Marcus's fingers hovered over the backup drive containing 3 hours of surveillance footage showing exactly when Dr. Ashford deliberately ignored pages. Exactly when he left a board meeting to check his phone. Exactly when he smiled and decided a child's life was worth less than his professional reputation. The next morning, Dr. Ashford walked into rounds with his chin high, his confidence fully restored. Elena was gone. The problem was solved. His department was his again, and nobody, not a nurse, not a colonel, not anyone, was going to tell him how to run his unit. He moved through the ICU with the satisfied smile of a man who had won. He'd made the calls. He'd protected his reputation. He'd erased the problem before it could metastasize. Tommy Brennan was alive, yes, but the narrative was already written, emergency intervention by a rogue nurse operating outside her scope. She'd be investigated. Her career would be finished. And Oak Creek Memorial's liability would be contained because Dr. Ashford had documented everything meticulously. He was, above all things, thorough in his self-preservation. The rotor wash hit the hospital like a thunderclap. Every monitor in the ICU spiked with alarm as the windows rattled in their frames. The fluorescent lights flickered once, twice, then steadied. Ashford's head snapped toward the window. Through the glass, 2 UH-60M Blackhawks descended toward the helipad like hawks closing on prey, their rotors cutting the Houston morning into violent sections of light and shadow. The sound was immense, the kind of sound that made your bones remember they were just sticks holding meat together. The charge nurse's radio crackled. Incoming. Multiple military personnel. They're requesting, stand by. A pause that lasted for seconds too long. They're requesting Major Martinez. Urgent. The color drained from Dr. Ashford's face like someone had pulled a plug. 6 Air Force personnel emerged from the stairwell in dress uniforms so crisp they looked like they could cut glass. Not flight suits. Not field gear. Class A dress uniforms with ribbons that caught the light, moving through the ICU with the kind of purposeful precision that made everyone else suddenly look like they were standing still. The lead officer, a brigadier general with the bearing of a man who had spent 40 years deciding who lived and who died, carried a classified file folder marked with red borders and a clearance stamp that made the hospital IT director's eyes go wide. Colonel Brennan followed 3 steps behind, his jaw set. His son was beside him, Tommy's small hand in his father's larger one. "I'm looking for Major Elena Martinez," the general said. His voice was quiet. The kind of quiet that made you listen harder than if he'd been shouting. The ICU went so still you could hear the 4 drips counting seconds into bags, 1 drop at a time. Dr. Ashford stepped forward. I'm Dr. Ashford, the attending physician. I don't know what this is about, but there's been a misunderstanding. There's no major here. There's a nurse, an employee who violated hospital protocol and performed a surgical procedure without authorization, and I've already reported her termination to. Where is she? The general didn't raise his voice. He didn't need to. She's been terminated. Escorted from the premises yesterday evening. I can provide documentation of her violation of. Sir. One of the uniformed officers stepped forward. We've already located her residence. She's not there. We need to speak with her directly. Colonel Brennan's eyes met the general's for a single moment. Then something shifted in the colonel's face, recognition, understanding, the kind of look a father gets when he realizes his child is alive because of someone who sacrificed everything to make it so. She's not coming back, Colonel Brennan said quietly. She's already gone. But she saved my son's life. And she deserves to know. He stopped. His voice broke slightly. I need her to know what she did here mattered. Tommy tugged on his father's sleeve. The boy's eyes were bright, alert, aware. The mutism was gone. When he spoke, his voice came out thin but clear, younger than 7 but unmistakably alive. Thank you, Major, Tommy whispered. The words hung in the air like a physical thing. Dr. Ashford's breathing became audible. That's not possible. The child wasn't capable of. I documented his condition as purely psychological. There's no neurological. Dr. Ashford. The general opened the classified file. His hands trembled as he read, not from emotion, but from the weight of what he was about to speak aloud in a public hospital unit. Elena Martinez, service number ending in 4672, Major, United States Army, classified assignment, 2019 to 2022. 2 silver stars. He paused. Looked up. For saving 17 lives during Operation Dark Horse in Kandahar province. 1 Purple Heart for wounds sustained in theater. A 2nd Purple Heart for injuries received during the extraction. The general's voice dropped further. Your nurse was ordered into complete anonymity after that mission was buried. Classified. No contact with her unit. No public recognition. No medals worn, no rank acknowledged. She was a ghost. By law and by presidential order, she was erased. A 2nd officer stepped forward. On the ICU desk, he set an external hard drive and a tablet showing security footage from yesterday. Dr. Ashford in a board meeting, phone in his hand, reading Elena's pages with a smile, then silencing the notifications with a deliberate tap of his thumb. That footage has been submitted to the State Medical Board, the officer said. The Hospital Ethics Committee. And military investigators, since the endangered patient is an Air Force dependent. As of 6 minutes ago, the board has requested your immediate administrative leave pending investigation. Dr. Ashford's hand started to shake. He reached for his phone like a drowning man reaching for air. Made a call. David, it's Ashford. I need you to call the board. I need you to tell them. The line went dead. He tried another number. Another. Each one the same, silence, rejection, colleagues protecting themselves from his collapse like rats abandoning a sinking ship. A hospital administrator appeared with 2 security guards, the same 2 who had escorted Elena out yesterday. Dr. Ashford. Badge and credentials. Now. Do you know who I am? 15 years. I bring in millions. Your credentials. His hands fumbled. The badge came free. As security moved him toward the elevator, he passed Tommy's room one final time. The boy sat upright in bed, speaking softly with his father, alive. Because of the woman Dr. Ashford had tried to destroy. 6 months later, Elena Martinez walked through the corridors of Joint Base San Antonio's medical training facility in Army service uniform, her rank restored and visible on her shoulders. Major. The dog tag hung beneath her uniform on its broken chain. She'd never fixed it, kept it broken as a reminder of the medics she couldn't save and the lives that she did. On her office desk, That same dog tag sat beside a photograph, Elena and Tommy Brennan, the boy smiling wide, holding a drawing of a nurse with silver wings. He spoke normally now, no trace of mutism, and his father said he told everyone that a major saved him. At a strip mall outside Houston, Dr. Ashford sat at a folding table beneath a banner reading Supplemental Insurance, Protect Your Future. His medical license was revoked. His colleagues didn't return his calls. A few people took his flyers. Most walked past without looking. Elena's phone buzzed with a message from Colonel Brennan. Tommy's asking if you're coming to his birthday party. She typed back, tell him heroes are just people who do the right thing when it's hard. In the training room, a young nurse asked her how she'd stayed calm, how she'd made impossible decisions. Elena touched the dog tag beneath her uniform. True class is what you do when the lights go out. When no one's watching, when there's no reward, when doing the right thing costs you everything, that's when character shows. She paused. You do it anyway. Outside the strip mall, a woman walked past Dr. Ashford's table without slowing, her child's hand in hers, heading toward a future he'd tried to steal. If you want to see what happens when a system finally protects the right people, when accountability actually reaches those who hide behind credentials and protocols, subscribe. Like this video. Tell us, have you ever seen a hero get recognized after being invisible? Comment below.